Hi, I'm Dave Siever of Mind Alive. It's August 14th, 2024. In part one of my two-part blog here on ADHD, there are some key takeaway points. One is ADHD. What is the definition of ADHD? ADHD is simply higher than average expression of inattention, impulsiveness, and distractibility. That's it. And that's assessed by a counselor or perhaps on a computerized performance test, and so on. Causes of ADHD are numerous. There's dozens of causes of ADHD type behavior. The worst cause probably is kids eating junk food, junk cereal, sugar, artificial colors, sweeteners, all that stuff. You can think of Captain Crunch and Fruit Loops and all that stuff basically as the cigarettes of food. Don't eat it. Throw all that stuff out. Fill your children's lives with BS. Give them lots of BS. What do I mean? Bigger salads, bigger soups, bigger smoothies. Keep it all fresh. Do not add sugar. Give that brain some good nutrition to work with. Look at their sleeping habits. Are they distracted by noises? Are they stressed? All those things play a factor in ADHD behavior. So, some of the things we can do besides getting their diet and lifestyle in order is entrainment works quite well for treating ADHD. We've done a few studies. The biggest study had 206 kids in it from grades 1 to 12. And over a 10-week span, most of the kids' reading improved by about 1 year. Also, there are improvements in reduced depression, reduced anxiety, better coping ability, better reasoning, and so on. A Burke's behavior study done by Russell and Carter found that in terms of classroom aggression, ADHD kids did much better when they had entrainment. So entrainment, we know, certainly works well for ADHD behaviors no matter what the cause is. Also, transcranial DC stim has been shown to work well for ADHD also. Now, ADHD generally is a disorder of the frontal lobes right in here. And the frontal lobes, not only do they mediate attention, but they also put on the brakes. A lot of frontal lobe activity is inhibition of behavior. So things like hyperactivity and impulsiveness are regulated by the frontal lobes. And so when they function well, everything settles down and we can pay attention and we can be calm, we can do what we need to do in a school setting especially, and so on. So if you use transcranial DC stimulation, the electrode, we have a long skinny electrode, and we would apply it right here between the eyebrows, put the cathode on the back, anode on the front, and it will jazz up brain function impressively well. And there are dozens of studies of transcranial DC stim for the treatment of ADHD behaviors. Neurofeedback has also been shown to help alleviate symptoms of ADHD. Transcranial magnetic stimulation, pulsed EMF, electromagnetic field stimulation. So there's a bunch of techniques out there, but always start with diet and lifestyle, stresses, noises that are waking children up at night, all that kind of stuff. Start with that first, because there's no point in trying to treat the brain if these other factors are always interfering. So treat those first before you get into neurotechnology, and then if those, there's a nice sailboat, isn't there? So yes, so do those factors first, and then apply neurotechnology at the end, and get everything tuned up really nicely. I'm Dave Siever of Mind Alive. Thank you very much for listening. Happy sailing.